We have been working with St. Peter's for over 4 decades, and the leadership on all levels has not only made us feel welcome, but they want to know that anything that we can think of becomes part of the hospital. And so the hospital puts up a sukkah every year. The hospital puts up Hanukkah activities. The hospital sponsors throughout the year, for every Jewish major holiday, a program. They invite not only the patients, but they invite the entire staff, Jewish and not Jewish, to come and participate, to be educated. We have taught classes of culture and identity to the nursing staff of the hospital, to the emergency room staff of the hospital. I've known the honoree, Les Hirsch, for more than 10 years. He's a consummate friend and leader. Les doesn't work. Les lives his job. He really believes in what he's doing. And it shows in the love that he has for his work. It shows in the love and respect that he gets from his employees. And I can just speak from myself that over these years, anything that Chabad House has brought to his attention, Les has said yes to and innovated, found a way to bring it into the hospital setting. It is an honor, a true honor, to pay respect tonight to Les Hirsch.
You know, St. Peter's has had a great relationship with Chabad House that goes back well over 15 years, and we're proud that we have a family room at the Chabad, and we have a room here at St. Peter's University Hospital. We're excited with the 47th annual dinner that's coming up in recognition for Chabad. What this commemorates is celebrating the relationship between Chabad and St. Peter's that has gone on for many, many years. And as you know, St. Peter's as a Catholic hospital celebrates diversity. I've had experience both in the secular side of healthcare, a long time leading Catholic institutions, and then also leading a Jewish institution. I have to say that among all of those hospitals, secular or faith-based, the relationship here at St. Peter's, I think, is unique with the community generally, the way that we're interwoven. St. Peter's is a regional hospital. We're very excited about what we do down in Lakewood, and many patients come from Lakewood. And we've had a number of children that have come to St. Peter's from Israel, sometimes for cancer care, or others for surgery related to scoliosis. We do a very unique procedure here that is done to correct the curvature in the spine.
גילינו לילדה שלנו עקמת בגב לפני כ3 חודשים. בעמוד שדרה נהיה כמו S. ביום בהיר, בלי תכנון מוקדם, בלי כלום. בוא לרופאים, אנחנו לרופאים הכי טובים בארץ, הסתכלו, ראו. רצו לעשות ניתוחים מסוימים בארץ, שהילדה כביכול אחרי ניתוח כזה, היא לא תגבה יותר, היא תשאר באותו גובה שנמצאת בו היום, והיא בת 11. לא הסכמנו לזה, התחלנו לבדוק באינטרנט, לשאול אנשים, הגענו לאיזו קבוצה של אנשים שביצעו את הניתוחים פה בניו ג'רזי. אמרנו, בסדר, נגיע לניו ג'רזי. ובניתוח הזה בעיקרון בשביל להיכנס, נכנסים מהצד, מורידים אוויר בריאה אחת, בשביל שיהיה גישה לעמוד השדרה. הניתוח הצליח פרפקט, אבל הילדה לא יוצאת מחדר ניתוח, שעה, שעתיים, 3. פתאום יוצא המרדים, ואז הוא אומר לך, יש בעיה בריאה, אנחנו נעיר אותה אולי מחר. מחר יעירו אותה והכל יהיה בסדר. הריאה לא מתנפחת. רוצים לנפח אותה, לא מתנפחת, נשארת קטנה. אמרו לנו, אוקיי, יעירו אותה מחר. למחרת, עוד יום. הילדה מורדמת ומונשמת. למחרת אומרים לך עוד יום. מגיע יום שישי. אנחנו כבר שבורים, חסרי עובדי עצות, איך שאומרים. נכנסים אלינו לחדר 2 צדיקים מבית חב"ד.
So for the past few years, I offer pastoral care as part of the chaplaincy at St. Peter's, and I'm there every Friday with the students. Sometimes I go in alone. So we walk into room 7, and I was expecting a typical visit, and I immediately noticed that something isn't right. I can see that the parents are very down, and the parents are actually crying. And I look at the parents, and I'm a little confused, and look at the girl, and it's quite common for the day or even 2 days after the surgery for the child or the patient to be semi-conscious or sleeping for large portions. And so I asked the parents, I said, what's the matter? Why are you crying? It's Purim today. I understand the situation that we're in, but Purim is a day of happiness. We can't cry. We need to sing. And we started singing, and we got up and we started to dance. And even while this was going on, I thought it was pretty crazy. And so everybody's a little bit in a lighter mood, but you know, the girl's still laying there.
So I started reading the Megillah. Before that, I asked the father, to make the brachas on the Megillah. And as he's reading the brachas, he chokes up and he can't continue. I wait quietly till finally he makes all the brachas. And I have to say that for myself, reading the Megillah, I also got very emotional. I also had to keep reading, but you know, in the Megillah where Esther asks for Hashem to save her and save the Jewish nation and everything that's going on, everything just clicked and everything made sense as if it was a live story that you're reading right now. And we finished reading the Megillah. I pulled out of my pocket a picture of the Rebbe. I gave it to the mother and I said, why don't you put it under her pillow to have the Rebbe's special guidance? She said, okay. They put it under, and as I'm walking out of the room, I see she starts moving her leg. So, you know, as a rabbi, I wanted to right away say, look at that, it's working. But I said, Shneir, keep quiet. You were here for 45 minutes, you read the Megillah, you made them crazy, so many stuff, just go out.
So the following Friday, I went into their room kind of anticipating almost, you know, that same negativity that I felt the first time, with the sadness. And instead, the father immediately gets up, he's got a huge smile, and he wasn't a small man. He comes and gives me this bear hug. And I just quickly glanced to the side and I see his daughter sitting there, you know, wide awake. So I said, so what happened? He says, you won't believe it. He says, less than 2 minutes after Rabbi Shneir walked out, she opened her eyes. And my wife saw that. My wife asked her, did you hear the Megillah? And she nodded. She said, yeah, I heard the whole thing. And then it's been in recovery ever since. And by the time I got back the following Friday, she was already obviously not there. She was on the regular road to recovery as if there were no hiccups. Thank God they're back in Israel, happy and healthy. When they came out of the surgery, the doctor said the surgery was a complete success. Everything had gone exactly according to plan. But when it was time for her to wake up, to come off of the medications or whatever it was, she just didn't wake up. So everything went as planned, but got at other plans.
ואז אמרתי, אם אין פה נס גלוי, אז מה זה? אני מאמין שהיה פה נס, והרבי ישב איתנו בחדר ובירך לי את הילדה. ועד עכשיו הוא שומר עלינו, וזו האמונה שלי.
Chabad is a wonderful organization. Leadership is outstanding. But no university in the United States, public or I believe otherwise, or private, has the extent of program and presence serving a Jewish population of students as the Chabad House does. So you're doing great things in the community, and anybody that's community-minded with that interest, I would suggest that they get to know what's going on at the Chabad House and support their efforts.